Hi, I'm Indu Subaiya. I am the co-founder of Health 2.0 and the co-chairman of Catalyst at Health 2.0, and I'm really excited to be here today with Andrew Lay, who is the winner of the Robert Wood Johnson Foundation AI Challenge. His company, Buoy, won the first place prize for AI and healthcare consumer decision making. And so I'd love to hear a little bit more from you, Andrew. Tell us a little bit about how this project came to be.
Sure. Thanks, Indu. So the origin story is back in 2013, I was in my last year of medical school. I was about to go off and do a career in neurosurgery. But then my last rotation was in the emergency room, and I was seeing patient after patient having Googled their symptoms first before going to the ER. And based on what they had read online, they were making one of two bad decisions very often. So either they were coming in when they shouldn't have, or worse, they were sleeping something off and getting much sicker, and we had to do something more drastic for them once they came in. Right around then, my dad got sick. He didn't go to the doctor after having a mini stroke. And, I asked him, why didn't you Google to figure out what to do? And he said, what am I going to find on Google? Which was a great point because, really, if you think about the first step in healthcare, 72% of Americans turn to Google first. So because of seeing that problem firsthand, I took a sabbatical from school and started Buoy, and we became obsessed with fixing that first step. So we built this company that leverages AI to interview patients like a doctor, and within 2 or 3 minutes, figure out the 3 likeliest diagnoses and then what they should do about it.
That's fantastic. How long did it take you to develop the algorithm and the kind of intelligence behind the platform? And can you tell us a little bit about that process of kind of training the AI system to be able to do that?
Sure. It took us probably 3.5 years. Yeah, 3.5 years to have something that we felt comfortable testing. How we built this, we first onboarded a number of professors here at Harvard who specialize in medicine, machine learning, and epidemiology. And we created this dialogue to say, how do you build something like this the right way? Because obviously there have been symptom checkers that have been around for decades. And for the most part, symptom checkers don't work. There's a study that came out of the BMJ about 2 years ago that showed they're about 34% accurate, which is pretty bad. And the underlying reason is the technology behind old symptom checkers are decision trees. So it's like we always like to say it's like a bad choose your own adventure novel. You have your cough, you turn right, you have a fever, you turn left, and then everybody ends up with something scary. So as opposed to using that approach, we actually read by hand over 22,000 pieces of clinical literature to build a statistical map of medicine. So one that would understand the relationship between risk factors, diagnoses, and symptoms. So for instance, our algorithm knows that if you are a smoker, these 160 diagnoses are more likely. And specifically, it increases the risk of pneumonia by a factor of 5 based on these 10 papers that we read. And then if you have pneumonia, you have a 90% chance of having a fever based on these 6 papers that we read. So the algorithm basically was trained initially on this data set from papers. But what's neat is that every single time someone uses it, the program is getting better because we understand, how people are answering questions, how they're talking about their symptoms, and then ultimately what they were diagnosed with. So that's how we built it.
That's fantastic. So tell us a little bit about the rollout of this platform to that consumer audience, because at the end of the day, I think that's where the rubber hits the road in terms of adoption and utilization. So what are your plans for getting it out there?
So we released the free version of Buoy back in March of 2017. And I specify the free version because we have an enterprise version of Buoy that we sell to employers. But the free version of Buoy, we released in March of 2017. By the end of the year, we hit about 3 million unique users. And then this year, 2018 alone, we're on pace for about 25 million unique users. So yeah, that's the adoption so far.
And do you follow the results of especially the consumer platform, when you find out whether somebody actually did, seek care, what the outcome of that was?
That's a great question. So right now, we're about 10% of our population is healthy when they're using Buoy. And so they'll tell us that they were previously diagnosed with this, which is a great data point. Going forward, likely early next year, we'll have follow-up features that allow the patient to tell us what happened in the future if they were currently sick. And very soon, we're about to release a significant number of profile features that enable a person to save anything that they've done on Buoy and create their own patient medical record.
That's fantastic. So what do you plan to do with the winnings of the RWJ prize competition?
So we have a lot of engineering needs. So it's going towards hiring another engineer to help more people faster. So we see a person every 3 seconds from start to finish. And so what's neat is that the winnings lead to someone literally getting help faster, so we're really excited with that and honored, of course, by the prize.
And in terms of exposure to new customer bases, is that also something that you hope that the challenge will help you with?
Absolutely. Specifically with that enterprise product, we're talking to a significant number of employers right now, and I hope this helps get the word out.
Fantastic. Well, congratulations again, Andrew, and all the best with Buoy as you go forward. Very excited.
Thanks, Indu. Appreciate it.